And the mother that can't be loving, who's wounded herself, who was abused herself, who's doing the best she can, but doesn't know how to be nurturing, that's abandonment too. The conscious mind looks back and says everything was pretty good, but the buried pain is still buried, and it needs to heal. That's why later on, when a relationship occurs in which there's some degree of abandonment, the natural therapeutic process that many of us have to cultivate is to discharge the feeling. Just cry the tears. Let out the anger. Let out the fear, so that it's released based upon the principle, what is revealed is healed. This level of healing is what is revealed is healed. Doesn't have to be a dissertation, doesn't have to be an intellectual understanding. This is a child, the risk for chronic fatigue and early adverse experience, 43 patients and 60 non-fatigue controls, questionnaires regarding childhood trauma. The chronic fatigue patients had significantly higher levels of childhood trauma compared to controls, with a 3 to 8% increased risk for chronic fatigue syndrome. This is a study on obesity and physical abuse, sexual abuse in childhood on nearly 5,000 women. Both child sexual and physical abuse were associated with a doubling of the odds of both obesity and depression. Disclosure of Trauma and Health in Holocaust Survivors, published in 1998. They had 33 Holocaust survivors. Talked about their personal experience while they were monitoring their skin conductance, the basis of the lie detector test to see how activated the stress system is, and their heart rate while they were videotaped. Then independent judges measured trauma rates based on the skin conductance and the heart rate, indicating if it was a real disclosure, a real emotional disclosure, or was it some non-committal kind of talk about something without the feeling. 14 months after interviews, self-reports were collected. The degree of disclosure positively correlated with long-term health. See, we don't create experiences, or some people would say, we're not given so much that we can't handle it. But we have to stay connected to our heart in order to handle it. Expressing emotions is standard equipment in children, and is, when sustained, creates balance later in life. It's important to express emotion. I'm not talking about hysterical displays or violent anger. I'm talking about healthy expression of emotion. I've had people say, well, if I were to get angry, I might kill somebody. That's the ego with its never-ending reasons not to express emotion.
Dr. Peters told me to do it.
Dr. Peters told me to deck you. I'm expressing my anger. It's his fault. This goes on and on. This is a study on inflammation and heart disease, mediated by these pro-inflammatory cytokines, stimulated by negative emotions. The ability to unwind after a stressful encounter downregulates the total stress burden. Prolonged intrusive ruminations following a stressful trauma leads to immediately downregulation of the immune system. I'll let this one go. These are children who had a daycare center. 30% of them have group A strep in their throats and they're asymptomatic, no signs of infection. 75% have mycoplasma, no signs of infection. Even pneumococci, which produces pneumococcal pneumonia, no signs of infection. They're followed for infection, and what happens is loss of family routine is what created for the organism to create the infection. Emotion is the chief source of all becoming conscious. There can be no transforming of darkness into light and apathy into movement without emotion. Again, nobody wants to stuff happiness, love, and joy, but they think they can stuff the anger, sadness, and tears. We do not become enlightened by imagining figures of light, but by making the darkness conscious. To make the unconscious mind conscious is the essence of the spiritual experience. On one way to look at it, and this is what Robert Johnson says, the word religion means to relate, to put back together in, to heal the wounds of separation. So, I'm not going to get into this at this point. How are we doing for time? Do you want to hear about the cancer patients? Or are we had enough?
You're the doctor.
How's everybody doing?
I think I'm an overwhelmed with transformative thinking.
Mental indigestion.
Yeah, yeah. I mean, really.
Cancer patient, I believe, is an extreme example of this. Childhood stress, repression of emotion, projecting the emotion into the outside world, but not expressing the feeling, which is the key. Repression of emotion is the key feature. Because they keep projecting it, eventually they get to the I can't take it anymore, and this creates the helpless, overwhelmed feeling, and cancer becomes a way out of the pain. Childhood abuse linked to cancer in adulthood. Childhood abuse, physical abuse, was linked to a 50% higher risk of getting cancer. Many researchers have documented the difficult life experience in childhood. It's been discovered, it's been identified in various types of cancer. Childhood marked by cold, strict, aloof parents. The non-expression of emotions is the hallmark of the cancer personality. This is Dr. Tomoshuk studying melanoma patients. They never expressed anger, rarely did they acknowledge fear and sadness. They maintained a facade of pleasantness even under the most painful, aggravating experiences. They strived excessively to please people they cared about, to please authority figures, even to please strangers. Polite, apologetic acquiescence. Lung cancer. Eventually develop feelings of hopelessness and helplessness. I can't take it anymore. It just means that they're not following the natural therapeutic experience of releasing emotion, learning from painful experience. You have to discharge the feeling. Cancer is a symbol, as most illnesses, of something gone wrong in the patient's life, a warning to take another road. I'm going to get to the end of this lecture pretty soon. They go on for hours.
Make it 2 parts.
So I'm going to call it there. This is information on depression. I wanted to get meditation is important. And then this is the end.
This is a speed reading?
Yeah. This is a book looking at the underlying emotional issues in the unconscious mind with chronic fatigue syndrome, colds and flus, unconscious underlying issue related to ordinary upper respiratory infection, colitis, these are the underlying issues.